Yusuf, sorry.
Okay, so the University Hospital of the West Indies has established a registry for collecting convalescent plasma for the treatment of COVID-19. This plasma will be used in some COVID-19 patients with severe or who have the disease very severely to aid in their recovery. Well, joining us to tell us more about how this works, principal investigator of clinical trials for convalescent plasma, Dr. Gilian Wharfe. Dr. Wharfe, good morning to you. Thank you for being here.
Morning, Doc.
Morning, Simone. Morning, Neville.
Okay, did we get that right a while ago, what we said?
Very correct.
Okay, just me.
Interview is over here, all good.
Okay, that's the Cliff Notes version. Okay, so let's talk a little bit about this treatment. I've heard it mentioned in the States. Is it something new? Obviously, it's a clinical trial. So it's something new that we're trying in Jamaica. How does this work, Doc?
Okay, so convalescent plasma refers to plasma collected from somebody with the disease under study. And in this particular case, we're talking about COVID-19. So we're looking for individuals who have confirmed COVID-19 and who have recovered. These persons have to be at least 14 days symptom-free. And the assumption is that in order to recover, you have to produce antibodies or protective substances to have cleared the virus. And this is the plasma that we need to use, which contains these antibodies in order to treat the ill patients who haven't been able to mount an adequate response to their infection and therefore unable to get their infection under control. So it's a kind of passive immunity that we're providing for sick patients.
Is this the same thing that is referred to as the antibodies test?
So it's an antibody. So we need to test the recovered patients for antibodies, and we want to use persons who have high levels of antibodies in their plasma as a source of convalescent plasma.
Okay, gotcha.
Forgive my ignorance, Doc. Plasma is blood?
Right, so plasma is a component of blood. So blood is made up of a liquid part and a solid part. So at the bottom there in that picture, you can see what would be the solid part or the red cells, and above it, the yellow color substance above it is the plasma.
Okay. Sim said earlier that I think she said it's been used elsewhere. So how do we know that this will work, can work?
Right, so we have had some prior experience with other pandemics in which persons have been given plasma from individuals who have had the infection, and these persons have recovered. The issues we have with those prior trials is that they haven't really been controlled trials. So persons have gotten a variety of other substances along with the plasma. They didn't select the patients very carefully. And so you're not entirely sure that what you have done, that intervention, is the one that has worked. And therefore what we are doing and what others in the international community would be doing would be to have a more controlled situation where you select the individuals to be treated, you select the plasma that you want to use, and you would have matching populations, a population who is getting the intervention and a population who is not getting the intervention. And therefore you want to see what the outcomes are. And the outcomes we'd be looking at would be time to recovery, time to coming off ventilators if persons are already on ventilators, time to improvement in oxygen levels in those individuals who have received the plasma as opposed to those who did not. And so you can therefore suggest that the intervention is what has helped these individuals.
Right. Okay, so how do you extract, Doc, for people who are saying maybe we want to come and try this? What's the process?
Right, so our persons who have recovered, we would like them to volunteer, just to recognize that perhaps you can do something to help somebody who has been ill or who is ill with this infection. And so we have the contact information that is there, that individuals can call us at 876-977-2327. They could send us an email at plasmasupport@uhwi.gov.gm. They can go to the website and leave their contact information. All of this is confidential. So we are a small group of researchers. The information is amongst us alone. It is not something that's being shared with the wider community. And in fact, the donors are actually going to be assigned numbers, study numbers. They're not going to have their names attached to anything. So nobody is going to know who these people are. And we know that there has been some issues with people being marginalized because they had the infection.
Yes.
So this confidentiality is very, very important. And I think what these individuals who want to donate or who want to consider donating their plasma need to recognize is that these are persons who are relatives, they have families, they have friends, they have things that they need to do in life. And if they can intervene and offer these people some sort of assistance with recovery, then this is really something that they're doing for the community, for the greater good of these individuals.
And you have to be between the ages of 18 and 60,
18
right?
and 60. So we need the safety of our donors as well.
Right.
Yeah. Going back to, sorry,
yeah.
Doc, but going back to Sim's question again, how is it extracted? You're just giving blood, right?
No.
You're not.
So this is a special process by which we collect the plasma, because we want our recipients, the persons who are ill, to get 2 units of plasma. So that's 200 ml collections of plasma. From an individual patient, by the usual blood collection process, we can only collect 1 unit of plasma, and that person also will lose red cells. That's your donor. By this process, we have a special piece of equipment, a machine, where the individual who is donating would be attached to this machine, and the blood is going to be taken off from that individual. They separate it into the plasma and to the cells. The red cells are returned to the donor.
Okay.
And all we keep would be the plasma.
Okay.
And that way our donor is not going to get anemic from
Gotcha.
giving this blood.
Very important point there, Doc. I have one more question for my part. There are so many people who, well, certainly in the States, who find out they have COVID or have had COVID only after they go voluntarily to get an antibody test because they were asymptomatic. I suspect, or do you suspect, that there are any Jamaicans who are in that bucket, maybe suspect they may have had it? Would you want them to come and test? Or are you saying only if you know definitively that you were diagnosed is when you should come in?
Right. For the purposes of this study, we have to have persons who had a test for SARS-CoV-2 and tested positive. So only those persons who have had a confirmed positive test. And we've had lots of them in Jamaica. We've had lots of recovered patients. If only 50% of the recovered patients are suitable donors, that's a lot of persons. And we are only asking for 60 persons to come and donate.
Yep.
Yeah.
And my final question, Doc, is there a concern that I might not want this to happen to me because it's coming from someone who tested positive?
So nobody gets it without consenting to the process. So it's an informed consent procedure. So we explain to them, this is the situation, this is what we would like to offer you as a potential treatment because you have severe infection. And only if you sign an agreement to receive that will you be given. So you do have the opportunity to say no.
And what's the worst that could happen if it doesn't work the way it should?
If it doesn't work the way it should, you will just not improve, right? We would improve maybe for some other intervention, but not for this particular intervention. But in terms of complications, people can develop fluid overload. Of course, we are there monitoring this infusion as we monitor any other blood transfusion. So the complications that might be associated with blood transfusion can occur. But as usual, persons are monitored every 15 minutes once an infusion of blood products is being administered. So this is going to be no different at all.
Okay.
Thanks for
So
speaking with us.
can we put up the flyer again? If you're between the ages of 18 and 60 years, previously confirmed positive for COVID-19 by a lab test and fully recovered from the virus, which means you're symptom-free for at least 28 days, you're being asked to participate in this clinical trial to see if we can save some lives of folks who are critically ill or very ill with COVID-19. Thank you, Doc. Appreciate your information this morning. All the best with this
Thank you
trial.
very much for having me.
All right, take care.
Thank you very, very much.
Chairman, Principal Investigator of Clinical Trial for Convalescent Plasma, Dr. Gilian Wharfe.
Okay, A Little Girl's Dream. We're taking that off the shelf on the other side of the break. We'll be right back.